Welcome to e-luminate, formerly known as Sounding Board. e-luminate is a production of Seroptimist International of Novato. We will be talking to doctors from Marin Community Clinics, the largest provider of comprehensive health services to low-income residents of Marin County, California, one of the most affluent communities in the nation. We have today Dr. Jose Chibras, Chief Medical Officer. He's an internist at Marin Community Clinics, and Dr. Peter Simon, who's a pediatrician and the lead health informatics clinician at Marin Community Clinics. Dr. Chibras, what type of doctors and healthcare providers work at your clinics?
Well, first of all, thank you for having us here, and I want to address the community of Marin County, how important it is to have a community health center who is so fortunate to have some of the best physicians in the country working at Marin Community Clinics. We have comprehensive primary health care, which includes pediatrics, internal medicine, family practice, OBGYN physicians, and then we have a whole group of specialists, including radiologists, or radiology department, pharmacy. We have cardiology, orthopedic surgery, GI, urology, podiatrists, chiropractors, acupuncture, nutrition, extensive resources in dentistry for adult and children, and psychiatry. Behavioral health is really important, and really pharmacies, laboratory, and so we really do have comprehensive primary health care and specialty care at Marin Community Health Centers.
And it's a high quality of care.
Let me just share with you, that is so important. We see almost 180,000 visits last year, and we're going to exceed 200,000 visits this year. And our growth is important to the community, but more importantly are the awards that our clinicians and our staff have received. In 14 counties, we are in the top 10 percentile for quality, and nationally we're recognized for the quality. And some of the best physicians in the world, in the country, live in Marin County, and we're fortunate to have that staff at Marin Community Clinics.
Yeah, it was really incredible. As I was looking, years ago, I had a place to work, and I looked at different clinics. I was really, really amazed by the caliber of the providers here. Like I said, we have, physicians assistants, nurse practitioners, but across the board, it really was incredible. It was really, even today, as you look around, and often a lot of the questionnaires that we ask providers, what keeps you here at Marin Community Clinics? People often cite first, the patient population we serve, the commitment to mission, and right up there third is the quality of their peers. I mean, these are providers who I think could be working anywhere, and because they're so committed to this population, they come to Marin Community Clinics. I recently had a baby, and as I was thinking what kind of pediatrician I wanted and what we're looking for in our future pediatrician, I couldn't help but think of my peers. And those are the models that came to mind about the kinds of people I want to take care of my children. So I think it says a lot when the providers in the system kind of want to, are proud or eager to bring their own loved ones to this system.
Yes, indeed. That's wonderful to know. Yeah. Do you deal with prevention at your?
Yeah. I mean, prevention is a lot of what we do. I mean, I'll let Dr. Chibras speak also, but as a pediatrician, I think prevention is baked into the practice of pediatrics. In addition to patients being able to come in when they feel sick or ill or they have a concern, we have scheduled visits when we want children to come in at program ages just to monitor and make sure everything's going according to plan. We routinely screen them for developmental concerns or problems. We, at those visits, give routine vaccinations to prevent a lot of the illnesses that we see even becoming more prevalent as certain populations come down in their prevalence of vaccinations. We have routine screenings through all of our visits for healthy weight, healthy levels of activity. We also make sure to include special questionnaires where we're making sure that our patients are doing well at home. In addition to their physical well-being, a lot of our patients are dealing with stress and difficulties with food instability or hardship at home. And those are things that we're always trying to address or discover before it becomes a bigger problem and affecting their health.
With the adult population that I'm privileged to serve, we're definitely very interested in secondary and tertiary prevention, and let me just define that for the audience. Secondary prevention is when a woman comes in the community health center, like a lady that I saw last year, who came in, was seen by one of our GYN specialists, sent her for a mammogram. There was a small little mass, totally treated. She's going to do extraordinarily well, have a full life, be able to be a grandmother, and that's an example of doing early detection of a disease that's present in a woman or a person, and you can change the course of that disease. So that's secondary prevention, which is very important. And then I also practice internal medicine, which entails tertiary prevention, which is seeing a father or a mother or a grandmother or somebody who's had a stroke and preventing a second stroke. And so we make sure that through our nutrition classes, our exercise classes, that we have Tai Chi, yoga, stress management classes. We have a pharmacy where we make sure they have appropriate medications to be treated. And the specialists that take care of folks, a cardiologist, or maybe they need an orthopedic surgeon or somebody to help them to be mobile. And so tertiary prevention is when somebody's had an illness or an event, and we prevent the other event from happening. And so that is, like Dr. Simon mentioned, we do this at extraordinarily well, and our metrics and our outcomes nationally and in California prove that we're an exceptional place to receive health care. In fact, community health centers should be the first place that folks seek health care. It really is an important model that's been around for over 54 years, and we really embrace all community members and geriatric folks, the whole family, to come to our health center. We provide health care from conception all the way through the end of life, and we help them through transition.
And if I could add one thing, you mentioned earlier I was involved in health informatics, and I think just to kind of clarify what that means, as an organization, we think all the time about how to identify and prevent these problems before they become bigger problems. So designed into our systems, we have ways to remind our providers from the moment the patient walks in and is seen at the front desk, their vitals are taken by the medical assistant, they move into the room, everyone on the healthcare team is thinking about what should I be checking for, and at certain ages we routinely screen for colon cancer or sexually transmitted infections, or give out questionnaires to assess the situation at home, or make sure the mother of a new child is not feeling depressed. So all of that prevention is really built into the whole system of care.
Now, Dr. Simon is very modest, and so when we talk about population health management, what we do is utilize his expertise in our quality team to be able to know our patients extraordinarily well and know when something is due, and remind them to please come in for your colonoscopy, or come in for a cancer colon screening test, and not just ignore it, but you talk about prevention. It's all about informatics that he brings to our organization, and our team of quality that really make a difference for our patients.
Yeah, we have a health quality team which is constantly thinking about the health of our population before they walk in the door. So they constantly run reports on patients that we've taken care of and find out who's due for things that we haven't seen in a while, and we'll call them and we'll send them letters and say, it's time to be checked up. And we're constantly trying to identify problems before it leads patients to become severely depressed or injured or have a terrible diagnosis or be seen in the emergency room. So I think we try to stay ahead of these problems.
Who can come to the clinics?
Community health centers for 54 years are community health centers, and we want everyone to utilize our health centers, whether it's our dentists, our chiropractors, our radiologists, our psychiatrists, our pediatricians, our family docs. Everybody's welcome at community health centers.
Really? So if you have too much money, you can pay. If you have no money, you can still be treated?
What you just said is really important. We have certified enrollment counselors, so if you come in-house, we have individuals that they're not selling insurance, but they will help you navigate the insurance plans that are available and try and help you get insurance, whether it's outside of our facility or with us, free of charge. And so it's really important for folks to really consider a community health center for 100 reasons.
I see this a lot with recent immigrants. So families that have recently immigrated are brought into the healthcare system because as they try to enroll their child into school, the school says you need to get a physical or you need to get vaccines. So they come to the clinic and I see them as patients. And I feel really, really fortunate to be able to tell this family, it's great that you're here and we can take care of your child and we can take care of his brothers and sisters, and let's see what we can do to get you enrolled and also get you care. And I think we work as a clinic system to see where we meet each patient, but we are committed to her serving the whole population.
You know, with healthcare reform in the ACA in 2010, there's individuals that have covered California. And as they work, they come off of public assistance, they have private insurance, they change to another job, and then they're without insurance, and then they don't know what to do. So we help them either get on Covered California or some other public assistance programs. And it's really important for them to know that it's difficult sometimes to get on a computer and figure out what to do. I had a 62-year-old man who was in that position last week, and it just lost his platinum Covered California and wasn't sure what he could do. He was too young for Medicare, and so our enrollment counselors helped him get insurance. And so, you know, it really is important for them to know that we do more than just provide health care. There's a lot of resources.
Speaking of Medicare, you
Yes.
mentioned Medicare. Can you take Medicare?
We take Medicare, and you know, 7% of our patients that we see have Medicare, but definitely we've got internal medicine doctors and family docs that see folks every day for chronic illnesses, and with our specialists to support, it really is an excellent place for folks with Medicare to come to our community health centers to provide care. We also have dentistry, and our dentists are taking care of adult patients as well.
You've expanded my ideas about what's going on at Marin Community Clinics. Thank you. Do you have anything you'd like to add to what we've already talked about?
Yeah, I just want to thank you for the opportunity to let us share with the community here in Marin County about the excellent services that Marin Community Clinics are providing.
Well, we're
Thank you.
enlightened. Thank
Thank you
you.
so much.
Thank you.